Next, I'd like to introduce someone who needs no introduction, someone who I've worked with in law enforcement for longer than I think either of us would care to admit. Stephen Perry, Commissioner of Public Safety of the City of Providence. Commissioner.
Thank you, General. You know, when the Office of Attorney General broached this subject with the police chiefs and my office, at first it was, whoa, where are we going? You know, what message does that send? But as you begin thinking about the impact and what we're doing to people that suffer from a health condition, and make no mistake about it, I defer to the doctors and the professionals that clearly identify use of these illegal drugs as a health condition. And by incarcerating them, not having the services in the prison system is the wrong way of going about it. And so as you peel back and understand what this does, I came to realize this makes sense. And the General and I, and he brought it up probably 25 years ago, when the General Assembly changed the law that made it legal to possess a needle and syringe. I was a young trooper at the time, and I thought the state would turn into a lot of addicts. And we were wrong. And at times, law enforcement is trained to enforce the law, and the effects of enforcing the law wasn't our concern. We got to think smarter and deal with this issue as a public health condition. And this is what this is. We are not decriminalizing the possession of a controlled substance. We are making it easier for recovery. I can't tell you how many times I've received calls from someone that had a conviction on their record and now want to coach their son or daughter and can't. Or they can't go into the schools and become a teacher aides or volunteer. And that causes devastation to the relationship of the family. Not only having it on the record, on their record as a conviction, then everything that flows from that, with employment, with opportunity, with housing, we are pushing a percentage of people that suffer from an addiction because of a health condition. And so how many are we talking? I didn't know. So I looked at Providence and said, how many possession cases do we have annually? And it's 220 on average over 5 years, out of 1,600. I say it's time that we start treating these people as a health condition, start giving them opportunities. If we really believe in rehabilitation, this is a step in the right direction to get them out of, you know, addiction every day, one day at a time, and giving them opportunity for employment, to be a parent, to do the things that this otherwise would bar them from doing. So, you know, it is shocking, as I said, as you sort of peel back and understand what this does. This really does make sense. And I applaud the Attorney General, the Senate also, and I look forward to the House and having a discussion about making this right. Thank you.